There we go. Hey everyone, it's Dr. David here. Thanks so much for joining us live. I appreciate y'all coming online, getting ready to ask your questions about meniscus issues. We already have some questions here on the chat, and today we're talking about just meniscus injuries in general. I'm going to favor questions that are for non-surgical situations, but I know it's going to inevitably come up that meniscus surgery questions because people end up having surgery for meniscus problems all the time. So as we just let people jump on here, everybody please let us know, jump on the chat, type where you're from, what part of the world you're from, city, town. Don't give us your address, please. And I just want to see where people are from. I see Caroline here from the UK. Hey, Caroline. Mono Ralph from Pennsylvania. And we have Shanna as our moderator in the chat here. So she's obviously from Texas, where I am in the US. And we're on TikTok as well. And those of you on TikTok right now, please share live as well as on YouTube. Please share this with anybody that you think needs to hear about this, or share it to Facebook, YouTube, wherever you want. Email somebody about it. Oh, we got more people. Scotland. Hey, Mags Magoo. And we got Cleo Jackson from Tennessee. Hey, Cleo. We have Marie from Walnut Creek, California. Very awesome. Melanie from North Carolina. Valerie from Jacksonville, Florida. And VH from Belgium. Awesome. Fantastic. Thanks for joining us. I know the hours might not be it might be a little darker where you're at. I'll put it to you that way. Vicky says hello. Hi, Vicky. Again, if you're on TikTok here, go to the bio and you can find the link to the live stream on YouTube if you want to do that. And if you have a question on TikTok, I'm not keeping up with the questions there. I have a moderator kind of pointing it back to YouTube, but you definitely need to get on YouTube to get to the right place to put a question in on the chat. So make sure you're on the chat on YouTube to get your questions in. And before I get too far in, let me just pull up my document here. I have my moderators helping me out with questions so that I get to the absolute best questions possible here. So meniscus problems that I see all the time. So I'm going to cover a few things with you here. Just like a teaser, if you will, or like some heads up information that I find. The number one problem I find that people have when it comes to meniscus problems is they overdo it. They're doing way too much too soon, and it ends up flaring up their meniscus. They start getting swelling in the joint. I have my meniscus model here. That's the meniscus right in there. They end up doing too much exercise, being on their feet too much. And it's confusing because you might not feel any pain. You might feel better after you're recovering from a meniscus injury. Like let's say you had one a month or two ago and you're gradually improving. That's great. It's rare that it's like completely gone in a day or two. Like that just doesn't happen. If you have a true legitimate meniscus tear, it takes some time. So as you heal, the pain goes away, but that does not mean that you're good to go back to running or jumping or even just being on your feet to do daily chores and activities. You have to still gradually progress in your time on your feet and your ability to do stuff. And it's important that you do progress. You have to gradually do more within your tolerance. And that's where people run into problems. They do too much too soon, and then they end up flaring up their meniscus. And when you flare up the meniscus, when you get that swelling, that pain, sometimes you're limited in your motion as well. Then you end up moving backwards, and that's where you can potentially tear it more. And that's where people just run into trouble where they can't seem to get all the way better. It keeps flaring up. They get better, then they do something and it flares up again. And this spiraling process is just so detrimental, ends up leading to another tear or possibly an unnecessary meniscus surgery. So that's, I think, the biggest thing that people face. All right, let me get my notes out here. So sorry, I'm losing my, oh, I got it right here now. Okay, Shanna's giving me some questions to answer. It is coming along. Hey, everybody on TikTok, just want to let you know if you want to get on to ask a question. Oh, I see people here from coastal North Carolina, Malaysia. Hey, what's up? Please jump on YouTube Live. Hit the link in the bio, and you'll be able to see it there. One question that I have that I want to make sure I answer for you guys is how weight affects the meniscus healing. I don't have the username in front of me right here. Maybe it'll pop up here. But the question was something like, how, if you have a lot of weight, if you're overweight and you have a meniscus tear, how is it going to affect your healing in your meniscus? Unless you're severely overweight, and to give you a number, and I'm talking, of course, in American pounds, more than about 50 to 70 pounds is the range where weight now starts to become directly important in healing your meniscus. If you're overweight and it's not more than about 50 to 70 pounds, if you're at that range or below the range, then chances are that you can still heal your meniscus just fine as long as you're doing the right things. Now, the meniscus is a weight-bearing structure. So this is the thigh bone up top right here. This bluish thing is the meniscus, and it's in between the shin bone right here and the thigh bone. And so when you stand on it, you put weight onto your knee, and that meniscus inside your knee has to support all the weight of everything above. But if you have a little extra weight, then it has to support more weight. But the cool thing is you can still heal your meniscus even if you have some extra weight, because there's plenty of devices out there like these that you can use to offload yourself. So if you just get on some crutches and walk with crutches, you can easily solve the weight problem, because the meniscus will heal as long as you take pressure off of it. It may just take you a little bit longer, but it's no big deal. You can still heal and avoid a surgery 100% as long as you give it space to heal and you decompress it, because it's a weight-bearing structure. It's designed to take weight. You have to take weight off in order to let it heal. So I hope that answers that question. That question came in before we even started the live here. So I'm going to answer the next question here from Marie Argenteri. She says, I had meniscus tear removal surgery 3 years ago. So that's a meniscectomy. My hamstring is really tight and affecting my gait and progress. Best exercises. Is this because glutes are weak? Great question. The hamstrings are going to stiffen up quite a bit if you have if you had a meniscus surgery, just because everything's going to want to stiffen up. The quads usually shut down after meniscus surgery, and the knees stiff and swollen. Sometimes the calf muscles want to cramp up too. But you need to make sure to begin to work the glutes, because that shuts off the hamstrings. Your hamstrings are probably cramping up or tightening up here because you're not getting enough support from the glutes. So you're right in thinking that way. You must have been watching some of our videos. Whenever you start to get the glutes to activate better, there's a reflex called reciprocal inhibition, where it shuts off other muscles that are trying to take over, like the hamstrings. So if you can get your glutes to activate better, then you should be able to get the hamstring to calm down. Now, you might still need to do some work on your hamstring. Usually massaging it is very helpful. When you massage your stiff, tight muscles, they tend to relax, but they're going to stiffen up again once you go to use them inappropriately. So that's something that you might need to look for, Marie. If you are using your hamstrings a lot inadvertently, start to train yourself to use your glutes, and then your hamstrings should shut off. And as you practice using your glutes while you're moving around, then you're going to be able to keep your hamstrings from tightening up and being overused again. Overusing your hamstrings and having tight hamstrings leads to sciatica problems often, because the sciatic nerve is right behind the thigh right here where the hamstring muscles are. And the hamstrings are divided in two different parts, the outer ones and the inner part. And between the two parts is where that sciatic nerve runs. So if you're using your hamstring quite a bit, if it's getting really tight, it can very often cause problems to that sciatic nerve, which is going to lead to pain down the back of the leg, the back of the knee. It might also cause pain into the foot, the calf, all the way to the toes. And this is especially frustrating if you've just had meniscus surgery to now get sciatica on top of that. So you've got to make sure to use your glutes well, Marie. Great question. All right, Daniel Penn is asking, does chiropractic adjustment help meniscus tear? Interesting question. If we're thinking about a chiropractic adjustment, it's usually in regards to the spine. Now, the spine has direct connections to all over the body because the nervous system runs out from it. So I think there's some connection for sure. Um, Whether it's important for you in your case specifically, I think you got to go see the chiropractor and see what they have to say. I'm sure they're willing to do like some wellness adjustments. If you feel like you benefit from it, then go for it. But if you feel like it's not for you, then I would say don't do it, because it's probably going to be setting you up for something that might hurt you. Now, as far as adjusting your knee, because sometimes people do that, I actually do that in the right case. That takes some specialist training, and I have yet to see a chiropractor be able to identify the shift that can happen inside of a knee, something called the tibial shift. I honestly, I haven't talked to a ton of chiropractors. I do know a few, and we just haven't had those conversations about the tibial shift. So I don't know if that's something they know about. I haven't seen one talk about it or try to check it either. So if you're looking to get your knee adjusted for meniscal tear, I would proceed cautiously with talking to the chiropractor and ask them about it. We have a video on tibial shift issues that can lead to meniscus tears. We have a couple of videos. So you can find those. One of them is called how to solve inner knee pain in 2 minutes, something like that. And I'll have to link them in the video here once we're done. Make a note to do that so I don't forget. Link tibial shift video. So if you're watching this video on the replay, you should be able to find it in the description. All right, I'm going to go on to the next one. AS Engineer is asking, does degenerative grade 1-2 intrameniscus wear heal? Great question. I can't say with certainty that it's going to look normal on an MRI. Whenever people ask, does a meniscus tear heal? I always have to clarify with them what they mean by healing, because if you intend to have a perfect looking MRI again, no, it's not going to heal. That's how you define healing. You're probably going to always have something wrong on your MRI, but it doesn't mean that your knee's going to hurt. Now, I would take healing as you're back to doing all your normal activities. And if you can achieve that after suffering a meniscus tear, an intrameniscus wear, grade 1, grade 2, then I think that's a win. And I think that's healing in my book. So if you're doing the right things to allow it to heal, then you're going to get back to normal activities. And the best analogy that I can give you, AS Engineer, is think of scars on your skin. Like if you were to cut your skin right here, and you know that your skin is broken there, you bled out, you scabbed over, you went through that whole healing process. After you finish the healing process, your scab falls off and now you have a scar. Well, it's obvious that something happened there, but is that skin still working for you? Yeah, you're not leaking blood, you're not leaking fluids. Skin is supposed to hold all your fluids in and not let you leak out. And obviously, if you cut yourself, things leak out. So if the scar tissue is effective in achieving the goal of what the tissue is supposed to do, that's a win. That's healing in my book, even though it looks like there's a scar there. If you heal in your meniscus and you're able to get back to all the things you can do, you healed in my book. But if you get an MRI and they can still see evidence of a tear or scar tissue of a tear there, they may say that your meniscus is still torn. But if it's functional, who cares? You're good. I'd say keep going in life. Keep maintaining the improvements you've made. Don't slack it. Otherwise, you can come back to having issues with your meniscus again. Great question, AS Engineer. All right, we're getting some good questions rolling in here. In case you're joining us for the first time here on TikTok or on YouTube, we're live right now. I'm taking questions. I'm a specialist physical therapist in El Paso, Texas. I'm at El Paso Manual Physical Therapy, and I'm answering questions about meniscus injuries. Ideally, if you have not had surgery, this is perfect for you. But if you have a surgery question, shoot, I'll help you out. All right, I'm going to answer the question from John next. He says, help, I need somebody to say my walking legs. If you can clarify that one, John, I'm a little confused. To say my walking legs. Okay, I'm going to come back to that one, John. Ashley McPeak is asking, is a knee pop a common side effect of a healed meniscus tear each time you bend your knee? Yes, Ashley, that's a good question. Popping can increase after you tear your meniscus. And the reason for that, you look at the meniscus right here, the blue structure between the bones. When you bend your knee, the top part rolls on that meniscus. And if you have a tear on that circle shaped structure right there, if there's a little flap, then it can cause inappropriate friction that makes a sound. Now, as long as it doesn't hurt you to do that, as long as it's not aggravating, you're fine. And you just need to monitor that it doesn't get any worse. And ideally, you should be maintaining great glute health, good glute strength, foot strength as well is something else that people need to pay attention to. That way you can minimize the pressures going through the meniscus and not allow the tear to get any worse. But it is common to have popping, clicking, crunching, grinding sounds in the knee. But if it's not painful, nothing to worry about. So I hope that helps you, Ashley. All right. Somebody named Hay is asking, if I had a left knee contusion like 2.5 weeks ago, my knee is very mildly swollen. The only issue is I can't really bend it backwards as much yet. Can I continue playing soccer? Good question. And before I answer that question, I just want to remind you guys on TikTok, I'm live on YouTube, and you can jump onto YouTube to ask questions. Check our link in the bio for the link to get to our YouTube live. And those of you here on YouTube, drop your questions in the comments. I'm answering them one by one. I'm going to be here for somewhere in the ballpark of 30 to 60 minutes. I'm between patients right now, so if they pull me, I got to cut it here. But I'm hoping my patient shows up a little bit late, so I have a little more time with you guys. All right, so to answer your question, hey, you're saying that you had a contusion. A contusion is the medical word for like you banged yourself and you got a big bruise, maybe even the bone is bruised. And you said it's 2.5 weeks ago and the knee is mildly swollen. The only issue is you can't bend it backwards as much yet. Should you continue playing soccer? It's a big, I don't know. The reason for that is because if there's other structures injured, like if your meniscus is injured, for instance, then playing soccer right now is a bad idea because you need to let the meniscus tissue, it's cartilage, you need to let it heal. And if you go start running and cutting and kicking a ball, there's potential for you to make it worse. Now, if you know that it's not a meniscus tear, which you're probably going to have to see a specialist in person to make sure that it's not a meniscus tear, then there's a chance that you actually can go back to playing soccer. If it's just a straight up bruise and nothing's torn, nothing's broken, then I think you could play. You're just going to be in some pain. I've had athletes come in here to the clinic and they have they're pretty banged up, but I tell them, hey, look, it's just going to hurt while you play. But I've checked all the ligaments out. I've checked the cartilage out. I've checked this and that out. You're okay to play as long as you feel like you can. A little pain medication is okay too, as long as it's nothing that you're relying on consistently. If it's just a one-time deal, I've checked you out. There's nothing that I'm concerned about that's going to cause you some long-term problems. If the other thing too is if you are clear, there's nothing torn, no ligaments, no cartilage, no meniscus problems in your knee, then the only remaining question is, are you limping because of the pain? Because if you're limping and you carry that over into running while you're playing soccer, then you're going to cause some other problem. But if you can you can force yourself to run normally and move normally while playing soccer, even though you're in a little bit of pain, then I'd say you're just fine. You can continue to play soccer. But if something's torn, if something's sprained or strained and you just need to give it some time, do not go back to playing soccer. You need to let that strain or sprain heal. You might need to get in a brace. You might need to be doing certain exercises. You might need to be on crutches for a time. If you have a meniscus tear, these need to be your friend. At least this, if not a cane, maybe even a walker, because you need to get pressure off that meniscus. All right, good question here. Those of you on TikTok, thanks for joining us. I'm on YouTube Live. Check out our link in the bio to get onto the YouTube Live, and you can drop any question you have there. All right, next question. Val1234. Hi, doctor. Why every time I try to squat or bend my knees, always painful? Great question. So this kind of goes back to what Ashley was asking about. If you have a tear in your meniscus, that's the meniscus right in there, that blue thing that I'm wiggling around. In the middle part, you can see where the bone is exposed. the meniscus tapers down, like it flattens out. It's thickest on the outside and thin in the middle. That's where the tears are more common, in the middle part where it's thinner. When you bend your knee, especially if you're squatting, like your body weight's on top of your leg and you're putting pressure as you're bending the knee, you can potentially aggravate that meniscus. And if you have a flap or some chunk of the meniscus there, it's going to potentially stop you from squatting full depth, and it's going to potentially be painful as well. So my advice to you, if that's the case, Val, is you need to go do some other stuff first. You probably need to make sure you strengthen your glutes properly, because that's going to decompress the knee, and it might reshift the little flap of the meniscus, or the meniscus itself, because the meniscus is very mobile. Just like I'm moving it around right here, like it's not super well attached to the top of this bone to where it's fixed. It has some give, and because of that, you have a chance at reshifting it, Val, so that you can squat better. But don't force it. You have to make sure that you gradually get it over time. And a deeper question I would ask, Val, is when you're squatting, are you going too low, and are you using your glutes? Because chances are, most people that I see here in the clinic that have had a meniscus tear, they're very quad dominant. The muscles in the front of their thighs right here, they're using those most of the time and not the glutes. And when they use the quads a lot, they start to compress the knee joint too much. And that ends up putting more pressure through the meniscus, which feeds into the tears. So if you're going to go do squats, especially with any sort of weights, that is potentially very harmful for your meniscus. And you might need to take some steps back and do just body weight squats, or even just make sure that your glutes are working well and not that your quads aren't over dominating your glutes. So I hope that answers your question there, Val. All right. VH has got a question before I answer that one. Hey, TikTokers, if you're joining us on TikTok, thanks so much. I see that guy, Car Show, says you got a YouTube channel, right? Yes, I do. Go to the link in the bio, that guy, Car Show, and you can jump onto, you find our YouTube channel, but you can jump onto the live on YouTube if you wanted to as well. The channel is called the Paso Manual Physical Therapy. All right. VH says, I heard certain exercises that twist the knee, like curtsy lunges, can lead to meniscus tears. Is that true? I've never heard of a curtsy lunge. This is new to me. Now I know what a curtsy is. A curtsy is like what the ballet people do. I'm not even sure how to do it, but it's like this kind of a motion. But yeah, twisty motions for the knee absolutely are going to shift that meniscus. You can see if I twist the knee slightly here, it's going to move the meniscus away from its position slightly. Now, there is twisting motion available normally in the knee. Everybody knows the knee bends and straightens out, but there's a little bit of twisting that happens too. And it's okay to do that. But if you have a meniscus tear, your tolerance for twisting motions might reduce. So I would absolutely avoid any sort of twisting motions if you can. Now, if they normally happen in your everyday movements, it happens. You know, you're changing directions as you walk through your house, or, you know, as you're running an errand, go to the store, that kind of thing. But if you're doing it with force, like if you're playing soccer or basketball or some sport activity that causes you to change directions at a higher speed than walking, then you're kind of asking for more trouble. If you already know that you have a meniscus tear, you probably should not be doing that. You need to make sure that your meniscus tear is under control and that you've done the work to stabilize your meniscus so that it's not causing you more problems if you start to turn directions. So yeah, it is true, to answer your question, VH. Hey, if you're on TikTok, go to the link in our bio, join us on YouTube Live, and you can ask us a question in the chat there. All right, next up, we got Mags Magoo asking, do tears ever completely heal? Great question, Mags. I was talking about this just a moment ago at the very beginning of the chat here. Tears, I think, absolutely heal. But the way they heal with scar tissue, just like skin heals with scar tissue. I was in a car accident as a teenager. Let me see if I can see this right here. There's some scars right there. This was a lot bigger when it initially happened. I had some glass from the windshield fall in my forearm here, and it's shrunk down. And the scars that I have here are skin scar tissue. So it's scar tissue that's got qualities of skin. When you have a meniscus tear, you lay down scar tissue that hopefully brings the tear together, at least seals the edges of the tear, and it's going to be cartilage or meniscus type scar tissue. So it's going to have qualities of meniscus tissue. And that scar tissue, we've shown in research, is about 70% as strong as normal meniscus tissue. And the cool thing is, meniscus tissue can change in its strength. You can increase its strength, you can decrease its strength. If you do the right activities, if you exercise properly, if you load your muscles and your joints properly, if you're not overloading them, then you cause cell processes inside the meniscus to cause the meniscus, the cartilage tissue, to get stronger. And I think this happens in the scar tissue as well. I can't confirm that with research, but I've seen patients that have had some blown up meniscus MRIs. And as we rehabilitate them, they get back to doing some pretty cool stuff, to running, to jumping, playing sports, cutting, changing directions, despite having a really severe meniscus tear, several tears where the surgeon was ready to do a surgery on them for their meniscus. So I think it's extremely possible to heal the meniscus. But like I said at the beginning, once you have a meniscus tear, you usually get an MRI. That's how you know. If you go through rehabilitation and you're back to doing everything normal again, I'd consider that healing. But if you had an MRI at that point, which I've never seen, because people are better. Why are you going to go to an MRI if you're better? People don't pay for that, or insurances don't pay for that for sure. So it's just not done. We don't have that kind of correlation all the time. But if you have that MRI after you're feeling better, it's probably going to look not too far off from the MRI when you got hurt. It's going to have a lot of problems on it. But if you're feeling better, you're back to doing things, I call that a win. You're healed. Great question there, Mags Magoo. All right, VM. I'm at 30 minutes here. I got a little more time. They haven't knocked on the door yet. VM, if the meniscus is torn and sore, could a side effect be that your knee suddenly bends backwards the wrong way under those conditions? Or is that a separate condition? Great question, VM. It's likely that there's other things involved in addition to the meniscus. So let me reword the question here to kind of make it a little smoother. If you have a meniscus tear, is it possible for your knee to start bending backwards, like to hyperextend? The knee is pretty well put together by the ligaments, and that helps to block too much extension. But the meniscus does play a role in the motion of the knee, so it definitely can be involved. But it is common, especially if you had a traumatic meniscus tear, like if you were in an accident of some sort, of sporting accident, car, bicycle, motorcycle accident. Those are all situations where you might get a meniscus injury, but you might also have an ACL tear on top of that, or MCL, PCL tear. Those are the ligaments inside your knee. If those ligaments are involved as well, then it is highly possible that you can start to overextend your knee. So yeah, it's possible. Hey guys, if you're joining us on TikTok, I'm live on YouTube right now taking questions. You can drop questions on our YouTube chat. Go to the link in our bio to get to the YouTube Live. Those of you on YouTube Live, if you're here for the first time, thanks so much for joining us. I make tons of videos helping people for all kinds of body conditions. Specifically today, we're talking about meniscus problems. If you go into the playlist section of our YouTube channel, you'll find playlists for different body conditions, and you'll find one for meniscus issues there. But I've linked it in the description as well here in case you want to see all our meniscus videos. All right, next question here. We got one from Cleo Jackson. My daughter stands and bends her knees back to pop them one at a time. Is she setting herself up for an injury in the future? I've seen that, Cleo, so many times, and I don't know, for me, I cringe whenever I see that. I'm tipping the camera down a bit here because I'm going to show you what people look like when they do that. So Cleo, you're saying your daughter stands up and she's standing and she kind of does this bit right here and pops her knee, and then does that with the other side, pops her knee there. It's generally okay if it's done sparingly. Like if it's done, here and there, like once a day, to give you a number, maybe twice a day at most. When it's a problem, Cleo, is if it's done every hour, because that's what I see some people do. If it's very frequent, that means that there's something wrong with the mechanics of the joint. In other words, the muscle, there's a muscle imbalance, likely the pressures going through the meniscus are off, and it's causing the cartilage to get stuck and then get unstuck all of a sudden when she extends her knee and there's a pop. That's what the popping sound is. Let me answer that question too, because everybody asks what's the popping sound? And there's all kinds of theories out there. There's nothing proven. Let me make that clear. The predominant theory, which I disagree with on why joints pop, is that there's gas release from the joint, and that when that gas releases, that it creates a popping sound. But I think it just doesn't make sense with how joints behave. What I think happens is, if you think of a jar of jelly or jam, something sugary, or honey is another one. You know how they get stuck because it's sticky, because it's got sugar in it. And if you twist it hard enough, it'll pop loose. That abrupt unsticking motion creates a popping sound. And I think that's what happens inside of a stuck joint, like a knee or in your fingers or in your spine. The joints get stuck because they're compressed, because I talk about joint compression all the time from muscle imbalances. And when you move it a certain way, it frees up and it starts to move better. That's why you have that sensation of, oh, that's better. My back's more free. I can turn my neck better now, or my shoulder popped. It's looser, or my knee popped, and now I feel more flexible, or it just feels better in my knee. So once in a while, that's fine. But if this is happening hourly, on a very frequent basis, Cleo, then she needs to probably fix the muscle imbalance, because she's getting constant overcompression that's constantly making her joint get stuck and giving her the sensation that she needs to free it up all the time. So in the long run, it's a bad thing. She needs to make sure she gets stronger, probably in the glutes. All right, Butterfly Twilight, I got you here. It says, I suffered an accident on the 26th of February. So what are we at today? The 20th. So we're looking at 2 months almost. Got an MRI done, a bucket handle meniscus tear with a partial to near full ACL tear on my right leg. Doctor, can I recover through your natural regime of therapy? Whew, I'm so sorry that happened to you, Butterfly Twilight. That's no fun. So you have a bucket handle meniscus tear. That means a tear that's kind of along the edge, not quite this way. I'll have to draw a picture, but it's like a bucket handle. That's the idea. And then you have a full ACL tear. I have treated people for sure that have gotten over this without surgery. Now, whether their ACL completely heals or not, I don't know. As far as like, does it reconnect? But I've seen people with disconnected ACLs do just fine. There's professional athletes that have no ACLs, or completely torn ACL, and they perform at very high levels. So as long as you get strong and your imbalances are taken care of, you should be just fine. The fact that you had this is, I think, a blessing in disguise, because if you treat this properly, if you put in the time and effort and the education to fixing your bucket handle tear naturally and making sure that your ACL is well taken care of, then you're going to do fantastic. The problem comes when people just start to rely on healthcare professionals to do stuff for them. So in other words, when you go to the doctor and they just say, yeah, we can do surgery, then they're just doing that for you, and they're not teaching you anything. They're not teaching you to get stronger in the right muscles. They're just reconnecting the ACL, which is cool. That might be what you need right now, depending on your activity level and your desire. But if you don't learn how to make sure that you put normal pressures through your knee, you're potentially going to have worse problems later on, like knee arthritis. So yeah, I would say go through our videos on ACL tears and meniscus issues and apply that. And we have a program, by the way, called the knee meniscus recovery program that might benefit you as well. The only caveat for that one, Butterfly Twilight, is you need to be wearing a brace for an ACL problem. I have one here. Let me show you what it looks like. So this is my favorite brace for ligament issues. This one has brackets and hinges on the side. So I can't take them out. They made the brace now to where you can't take out the brackets, but it's got them on either side. And it's got these nice straps, and it's very affordable. You can get it for about $50, and they tend to last pretty well. But the brackets and hinges on the sides of the brace internally keep the knee more stable so that you can heal it, because you should still be able to move around and do stuff. And because of the meniscus tear, you should probably be using some crutches as well so that you can offload that meniscus, that bucket handle tear, and make sure that you give it its time and space to heal. And as you feel more confident in moving around, then you should be able to do more aggressive exercise specifically for the glutes and feet muscles. And then that should allow you to get full range of motion, full weight bearing, of course, be able to get back to more intense activities like exercise. So yeah, I think it's very possible. We see people with that situation here in the clinic all the time. Hey, if you're joining us on TikTok, thanks so much. Somebody started following us. Thank you for following us on TikTok. I appreciate it. Join us on YouTube live. Go find the link in the description right now. You can get there right now. All right. So I lost my place on questions here. Krishna BK, I think we're on you next. Wait a second. I'm just getting a note here. Okay. Let me get to Krishna, and then I got Risa Snags next after that. So Krishna BK, when I sit for 2 minutes with bending knees, when I make them straight, I hear a loud pop near my patella region. Is there any problem? Both knees. So you're saying that you sit, I can't quite do it. I guess I can do it over here. When you're sitting like this, and then you get up, you hear a loud pop. That happens because you're compressing the meniscus. I'm sorry, you're compressing the knee joint. It could be the meniscus, but it could also be the kneecap. So I'll show you on the knee model here. Here's the kneecap right there behind, and it interfaces, or it touches this part of the bone right here, and then you have the thigh bone that connects to the shin bone, and the meniscus is between the two. So when you bend your knee all the way like that, you just compress everything in the joint, and it might stick when it gets compressed because you squeeze fluid out of the cartilage tissue and it dehydrates a bit, which makes it prone to sticking. So when you get out of that position, in order for the knee to fully extend, you might hear a pop sound on the way out. It's not a terrible thing. It just means that you might have a little dehydration going on in your cartilage. It could be because of your own fluid intake, but it might also be that you've been chronically compressing on a low level the cartilage in the kneecap or the meniscus potentially. And so you might have a minor imbalance going on. It's nothing urgent, Krishna, but you definitely need to make sure that you're working your glutes just to prevent any problems from happening in the future. All right, we're still good on time. Nobody's pulled me out of here. Risa Snags said, I did a debridement on my knee. The findings when I did the MRI was a tear in the horn of the meniscus, but the doctor went in and did a debridement instead, but I still get pain and I also do PT. I'm so sorry that you're dealing with that, Risa. That's no fun. Debridement, just for those of you that don't know, hey, if you're on TikTok here, I'm answering meniscus questions, and we're live on YouTube. And the question here is about a debridement of the meniscus. So they'll go in arthroscopically, which means they make little holes on the sides of the knee, and they put in tools through the holes, and they clean up the joint. That's what debridement means. They'll clean up. Whenever they say, we're going to clean up your joint, they're talking about a debridement surgery. And they're usually cleaning up like frayed edges. They might snip away a tear if it's hanging out in the middle of the joint where it shouldn't be. Things like that is what they're focused on. If you still have pain afterwards, then it's a sign that the root problem was not addressed, Risa. And the root problem is usually a muscle imbalance. And the most common muscle imbalance, I'll show you on the big model here, that puts way too much pressure on the knee joint and the meniscus is the thigh muscles here on the front. They connect to the kneecap, and then the kneecap has a tendon that comes down and attaches to the shin bone. If those thigh muscles are too strong, it pulls the shin bone up into the thigh bone and compresses the meniscus right here, compresses the kneecap against the thigh bone. And everybody thinks you need to strengthen the hamstrings on the back because it kind of makes sense at face value that the hamstrings oppose the quads, but the body doesn't work like that. It's more complicated than we think. When you strengthen the hamstrings, because the hamstrings attached to this part of the shin bone right here, it actually further compresses the knee joint. It actually worsens the problem. So we have to look up higher in the hip, the back of the hip, the butt muscles, the glutes right here are the ones that actually have the power to shut off or reduce the compression from the quads. So that's what needs to be addressed in your case, Reese. So you need to make sure that you have good glute strength and that you're firing your glute muscles without firing your quad muscles, which I need to make sure I explain today. That's one of the points I need to make. We had a question about that early on. Some people, once they watch our videos and they understand that glutes are really important, and maybe they even had some success with using their glute muscles and in relieving their knee pain, their meniscus pain. But then as they try to do more advanced exercises, they find that they can't fire their glute muscles without their thigh muscles working quite a bit too. So I'm going to show you here how to make sure that you can fire your glute muscles without your thigh muscles working so much. A lot of people want to go do glute exercises like squats or even bridges. And what I want you to do first, if this is you, if you're having trouble with this, just sitting like I am right now. Let me get back a little bit more. You're not going to be able to see my face very well. So sorry. It's probably a good thing you can't see my face anyway. Just kidding. When you tighten up your glutes right here, your thigh muscles want to fire. And that's not a good thing. I mean, it's going to happen to some degree, but you need to minimize it as much as possible. You need to be able to focus a good glute contraction through back here without your thigh muscles on the top and on the back, the front and the back of your thigh working so much. Because when those muscles work, it's going to compress the knee and aggravate the meniscus and other issues. So just in sitting, just think about tightening your buns, and you'll feel your body kind of lift a little bit when you do that. Hold it, and then think about relaxing your thighs as you hold your glutes clenched a bit. Hold it for 10 seconds. And if you're struggling to do that, you have to back off a bit in how intense you are firing your glutes so that you don't fire your thigh muscles. So if that was 100% what you did right now, 100% glute contraction, your thighs lit up, they tightened up too, then back off to 50% and see your thighs don't work as much. If they're still working, back off to 25 or even 10 or 5%. Really just barely tighten up the glutes and hang out there. Hold it for 10 seconds. That hold is really important because it starts to connect the nerves from your brain to the muscles in your glutes. You build a better connection that way. And if you continue to practice it, that the whole muscle memory thing that people talk about, it's a real thing. As you practice it, you start to reestablish a better pathway, nerve pathway from mental control to physical control of the glute muscles. And you just have to practice it. The reason why you're having so much trouble firing your glutes without firing your thighs a whole lot is because the connection is bad. That's essentially what it is. It could also be that the glutes are very, very weak, but usually the connection is bad. That's like the number one thing. And if you spend a good amount of time just figuring that out, that's going to set you up to now do glute exercises more successfully. I see a lot of people go try to do our exercises, our glute exercises, and they start having more knee pain. And one of the questions I ask them right away is, when you do that glute exercise, do your thigh muscles tighten up too? And consistently they say, yes, I feel my thigh muscles tighten up every time I squeeze my glutes. And I say, that's it. That's why you're having knee pain. That's why, even though you're doing a good exercise, you're doing a bridge exercise, or I'll have people just lie down. This is the one that they mess up all the time. I'll tell them, just lie down on your back, squeeze the glutes, and hold it for 10 seconds. Just like that. You're just lying down. You can do this in bed so easily. If your thigh muscles are going crazy while you're doing this, while you're tightening up your glutes, it's not good. This is the easiest way to do it. Just practice lying on your back, squeezing your glutes. Go 100% if you can. If your thigh muscles are starting to work too, then back off to 50% or 10% and just concentrate on getting your glute muscles to work independently of your thigh muscles. If you don't master that, you're not going to be successful in healing your meniscus without surgery. And even if you end up having a meniscus surgery, like the question I'm answering here, I had this debridement and I'm still hurting afterwards. It's because the root problem was never addressed, and the surgery is not going to fix it for you. The surgery is not going to teach you how to get your glutes to fire independently of your quads. In fact, most of the time it kind of makes it worse because the rehab afterwards tends to be focused on strengthening thigh muscles, which just reinforces firing your thigh muscles, which reinforces compressing the knee joint more, which leads to the next tear or the next meniscus surgery. So you have to, there's no way around it. If you have a meniscus tear right now, there's no way around, or if you had a surgery on your meniscus, you must figure out how to independently fire your glutes apart from your thigh muscles. It's okay that they both work, but you need to make this work more, significantly more than these muscles. And if you have that conscious control going into glute exercises, there's no way you can lose, because now you know that you can confidently fire glute muscles without your thigh muscles taking over all the time and adding that excessive compression to your poor meniscus that's already injured or already operated on inside your knee. Sorry, I went on a rant there. That always lights me up. I just wish it was taught more often. All right, guys, they're telling me that I need to wrap up here soon. Let me see if I can answer one more question. I hope that helped you, Risa, by the way. Debbie Dobrzynski. I'm sorry if I mispronounced your name. I am starting to have extended levels of pain in my knee, other inner side. What is the cause of this? So inner knee pain. Okay, this is a good one to tackle. One of the problems, lost the camera for a second. There we are. One of the problems when a meniscus injury happens, I'll show you, or it's better yet, this one. I'll leave this on my leg. It's the left leg. There we are. If you think of the bones in the leg, and we're talking about inner knee pain, answer Debbie's question here. The knee obviously can bend and straighten, but there's little bits of rotation that happen. You can turn your leg in and out, and most of it happens up at the hip, but there's a little bit of inward and outward motion that happen at the knee joints. And there's also a little bit of sideways motion right here. Let me zoom into that so you can see it. You can move subtly this way and that way in the knee joints. And you can test this and prove this, because people often tell me, even therapists and medical people tell me the knee doesn't move like that. But I'll tell them, watch, especially if you have bony knees, it's super easy to feel. If you feel the inner part of your knee right here, where you're probably hurting, Debbie, and you feel the bones right there, put your fingers on there, feel the ridges, feel the bones. Now cross your leg over. As long as you can cross your leg, you can do this really easy, just like this. And rest your leg on your other leg, and you should have felt a shift in those bones. And it's very easy to feel, especially if you're a therapist and you know what you're feeling for. Excuse me. Mouth got dry. What you should feel when you cross your leg like that is these bumps right here. And when you put that pressure on your foot right here, on your ankle, at the joint right here, it does this. It shifts that way. And that shift that happens, it might get stuck in that position and not allow you to bend and move properly, and it's going to hurt on the inner part. This is called a tibial shift. Sorry, it went down the wrong way. I'm okay. We're good. When that tibial shift happens, the meniscus, here's the knee model with the meniscus. If that shift happens that way, because that's the inner knee on this side, it's the opposite knee, it doesn't put the right pressure, because it's misaligned. It doesn't put the right pressure on the meniscus. And you can function like this. You can move around and do everything you need to do, but now you're wearing down your meniscus inappropriately. It just causes all kinds of problems. I think this is one of the most misdiagnosed knee issues that I see here in the clinic. And I'm always looking to fix that, because I don't know that anybody else can fix that. There's very few therapists that I've met over the years that understand that, know how to find it, know how to treat it. I teach all my students that, because people need to see it. People need that service, they need that treatment, and it's hard to do over the internet. But I've got some videos. I'll link them in the description here later on today to make sure that you can find those tibial shift videos, because they're very important in making sure that you fix the mechanics inside your knee. Sorry, I'm holding back a cough. So I hope that answers your question, Debbie, why you might have pain on the inner knee and what causes it. It's that shift usually that happens. Now, it could also be that the meniscus is irritated specifically on the inner part of the knee. The meniscus is a huge structure. As you can see the bluish structure right here, and it wraps around on the sides as well, inside and outside, and it's even in the back. So it's possible to feel pain anywhere along this kind of line, the circle line around your knee, right below the kneecap. There's a kneecap right there. It ends about right there. So if you just put your fingers like that around the knee, you can get to where the meniscus is. So I hope that helps out. Hey, I'm going to wrap it up here, guys. I've got to get going to my next treatment. If you are looking for more help for meniscus problems, I want to let you know that we have a meniscus program. It's called the Knee Meniscus Recovery Program. And this program is exhaustive in taking you through all the steps to recovering your meniscus. And specifically, we have this phase chart that I have available in the meniscus program that walks you through all the phases. And there's different exercises and different approaches to how to heal your meniscus based on each phase that you're in. So it's very detailed. And if you're looking for more specific help with our approach, I think it's a great setup for you, because I don't know of anything else like this, honestly. I've talked to therapists and how they treat their meniscus problems, and they just, I think it could be done better. And so I've put all that in that program. You can find a link to that program in the description below here. If you're on TikTok, it'll be in the bio after this live is over, so that, because right now the link there is to get onto our live. But get that program, or at least go to the page and learn about it. There's videos there for you to learn about it. There's a frequently asked questions video as well. I hope that you can get your meniscus feeling tremendously better, and more importantly, that you can avoid an unnecessary surgery. Or if you've already had a meniscus surgery, that you can avoid an unnecessary second surgery, because very often it's just a few things you have to do better and your meniscus will start to heal just fine. It's usually that you're overdoing it, or that there's a shift, or that you're strengthening inappropriately. That's a common one as well. I wish you all the best of luck. I wish you all the best of luck. Thanks so much for joining me on here, and I'll see you in the next video. Bye-bye.